For those of you who don't know me, my name is Brenna Leftwich. In perfect timing, there's Dr. Lowsky. But my name is Brenna Leftwich. I am an academic and industry relations manager for Aspen Dental Management, Inc., also known as ADMI. I have been with the company about 2.5 years now, and I work with dental schools and dental students from the Midwest to the West Coast. Specifically, I work with District 10 ASDA quite a bit. So it's a big shout out to you guys, University of Washington. Super excited to be doing this with you guys tonight. As you can see, I am joined by two incredible panelists. I'm going to have them introduce themselves here in a moment. First, I just want to let you guys know that I do have all the questions that you guys have submitted in advance. Thank you so much for doing that. We had some great questions submitted. They're on a screen over here to my right. So if you guys see me going back and forth, I promise there's nothing more exciting going on over here. I just have all your questions and gonna just moderate this and kind of keep it organized and make sure we can get through as many questions as possible for you guys. We also have a live Q&A. So if you guys have any follow-up questions, anything we're going over, or anything pops in your head in the moment, feel free to throw it in the live Q&A. It should be right at the bottom of your screen. You can also submit questions anonymously there as well if you would like to do that. I think that is about all I have for you guys. So I'm going to have our doctors introduce themselves. Dr. Nielsen, would you like to go first?
Sure. I'm Dr. Nielsen. Just graduated in May from University of Louisville School of Dentistry. And I've been working with Aspen now for about 2 months. And I'm actually from Washington, from here from the Tri-Cities. And so I'm working in the Kennewick office in the Tri-Cities in Washington.
Awesome. And Dr. Molesky, what about you?
Everybody, I'm Dr. Molesky. I'm working now in Washington State and Idaho. I grew up in Michigan. I went to the University of Michigan, and now I'm enjoying seeing the mountains and the sights, and hoping for a light winter this year. We'll see.
Awesome. Thank you guys for both joining us tonight. As you can all see, we have a new grad and associate, and also one of our practice owners. So definitely providing a couple different perspectives within the office for you guys to best answer all the questions that you have. So thank you for introducing yourselves. And with all of that being said, I think I will get started with the questions that you guys have submitted in advance. And just remember, this is an Ask Me Anything session, guys. So ask us anything. Easy questions, hard questions, that is what we are here for. We will give you our best and honest answers. So to start us off here, our first question is a nice broad one. Why did you choose Aspen Dental? So did you start with Aspen Dental? Have you ever worked for another DSO or private practice? So if you guys, I know you touched on your backgrounds a little bit, but if you want to elaborate more on how you got into Aspen Dental. Dr. Molesky, would you like to start us off?
Sure. Well, Aspen Dental was not my first career out of dental school. I actually did the advanced education and general dentistry residency in Baylor in Dallas. And my first job out of residency was actually terrible. I was an associate in a private practice, and you're into dental school for 4 years, and you're really getting excited about the profession, and then to have a bad experience off of the beginning is tough. So I actually left that, went into public health. I was a National Health Service Corps in the loan repayment program, working with the National Health Service Corps. And as I really developed my love of dentistry again, I did own my own private practice. I purchased a solo practice. I worked that, but what I was finding was it wasn't really satisfying me. It felt very lonely. It was very difficult to navigate. There wasn't a lot of good help. It seems like the people who were supposed to help you were really just, selling you things. And it got a little demoralizing. And my wife had an opportunity to move and pursue a PhD, so I went with her to do that in Indiana. And Aspen was going to be just a get me by job. I knew nothing about it. All I knew is my friend worked there, I saw his video or his face on the website. I said, hey, that's Clark. I'm going to call him. So yeah, he said, come on, check it out. They onboarded me. I got to onboard with my friend. And when I was working there, I really found the enjoyment of dentistry that I had never really got to see, because every single month I was encountering maybe 150 very sick patients who really needed dental care. And, you know, when you're in a private practice, you know, sitting hoping a patient comes, and now every single day you have 8 or 10 people who are just craving your skill set. I said, that's for me. And then from there, it's just been a great ride.
Mm-hmm. Thank you for that. And Dr. Nielsen, what about you?
I think what drew me to Aspen the most is stability, especially straight out of school. You know, the thing that I like a lot is when you come to Aspen, you have a salary that's based on, you know, just going there and putting in your best work every day. You know, it's not based on production. You know, having your pay based on production scared me a little bit coming straight out of school, because I know that I'm not that fast, you know. And Aspen offered a really safe option, and it felt like a place where I could go, and they understand that you're coming out of school and you're not lightning fast yet. And so it feels more comfortable, and I came out of school, you know, not afraid of having to go really fast right off the bat. And what I didn't know that I've really liked a lot since I've started is the mentorship that I've experienced. You know, I didn't even know how great it would be. I know that was one of the other top things I was looking for, was good mentorship. I didn't want an experience like Dr. Mossy, you know, described for his first experience. But it's kind of scary. You don't really know. But I can say that for me, mentorship has been amazing with Dr. Lowsky. He's a great teacher. And, you know, I can come to work every day, and I know that if I run into a problem, I don't have to be scared to say, hey, look, I'm stuck, and I can get some help. And in doing so, learn new things to help me through the next time I run into a problem, you know. So it's like a really fast track way to learn and improve and grow. So.
Mm-hmm.
Well,
Awesome.
since your first career was with me, I don't want you getting on saying your first job was terrible.
I will not say that.
Okay. All right. That's a win.
And Dr. Nielsen, you brought up some great points, compensation and mentorship, which we did have a few questions about. So we will definitely get into those as we get a little bit further into this. So I'm glad you brought that up. And before we dive in a little bit more, we keep using the term DSO. You'll hear that quite a bit, especially for you first years on here who haven't maybe heard that term. So I do want to elaborate a little bit. Dr. Molesky, do you want to explain to everybody what a DSO is?
Well, sure. DSO means Dental Service Organization.
Mm-hmm.
So when I was in a solo practice, I was the DSO. You know, I was it. It was me. If I answer the phone, write a check, whatever it was. But you know, in modern day healthcare, no one person is strong enough to make an office work. And we really need the power of a team. And what Aspen Dental as a dental service organization is bringing is not just the infrastructure, the people. It's 800 offices of lessons learned. They've been at it since like 93. They've seen dentistry change and grow and adapt. And so you have a support system of people who are not trying to sell you something, but really your partners who all have a vested interest in you being successful. And when you can dedicate yourself to your clinical skill set, especially in the beginning of your career, and not have to worry about keeping the lights on and you know, getting an occupancy permit and all this stuff, everybody wins, and you really enjoy the profession.
Mm-hmm. So while we're on the topic of DSOs, how would you differentiate Aspen Dental from other DSOs or private practice? Do you want to elaborate that on a little bit, Dr. Molesky?
Well, I would say the difference about Aspen Dental than any other dental service organization is our sense of mission. Um, when our CEO, Bob Fontana, started this back in '93, he didn't look to say, how can I make 800 individual offices great? He said, how can I change dentistry to make it easy? How can we really break down the barriers to let a doctor who wants to help patients and a patient who wants to get help get that done? So the brand is absolutely huge. Your patients are coming to you and they already have an expectation that, hey, these people are out to do it the right way. These people want to make it easy for me. Uh, Dr. Nielsen, even in his office, same day dental implant can be done. A patient walks in, there's no runaround. They can just get the procedure that day. We have the cone beam in the office. We have the ability to scan with iTero. We really focus on not just an individual office being great, but how as a brand can we really make dentistry great?
Mm-hmm. Do you have anything to add on to that, Dr. Nielsen?
Completely agree. The motto is making dentistry easier, and we do it every day. People come in that have had tough experiences with other dentists before, and you can just skip straight to getting it done. And people are happy because we're just getting it done. We're not making things complicated.
Mm-hmm. We did have a follow-up question somebody just sent in, and it is, what is the biggest benefit you have found working for a DSO? Dr. Nielsen, do you want to answer that?
For me, like I said, it's been the stability of not having to worry too much about production and speed right off the bat. Because the business staff, they run the business side of things, That's awesome. It's great to just be able to come in and not have to worry about the business side of things. Like Dr. Molesky said, not having to worry about keeping the lights on. You just come in and you have people that are dedicated to getting people in there for you, getting patients for you, and keeping you busy. And you just get in and worry about getting better at dentistry and helping patients find health,
Mm-hmm. Dr. Molesky, is there anything that you want to add about the biggest benefit you have working for a DSO?
Well, the ownership piece is really important when you look at like how you want your career to progress. In the beginning, you get very excited about all the procedures you're going to learn. But what you really become fulfilled is after you learn that, passing it down to the next person. And with the ownership, you can have a side of your career that's not strictly just clinical. You still get to do that, but you also have all the interaction with the other doctors, with people coming into the career right in the beginning, and helping them, learn from your past mistakes and see them develop even faster than you did. And it's very rewarding.
Mm-hmm. Thank you both for those answers. So moving on from DSOs a little bit, I want to go into the structure of the office that we have within Aspen Dental. We did have a couple questions on that. So to start us off with this topic, how many doctors are in each office? So I know this can vary a little bit, but Dr. Molesky, you own multiple practices. So what is the average model you have within your network?
We do a 2 full-time doctor model, and it's called ACE hours, means access to care extension. And so it gives a part of the day where you have an overlap of time, where you have 2 providers, but you also have a part of the day when you're on your own. So you can really rely on the help of your other providers, so you could be in a big case. And I love to see where the doctors, they turn up the music, they put their Grey's Anatomy surgical cap on, they shut the door, and it's like, it's go time. We're doing implants. We're doing all on 4. It just makes your day, you almost look forward to it. It's like, this is great. The time that you're on your own is also rewarding because you get to kind of see, what you want to do on your own and kind of interact with those patients. So I think the 2 doctor model is really great.
Mm-hmm. And Dr. Nielsen, since you are an associate, do you want to talk a little bit about the relationship within the two-doctor model that you have with the lead doctor?
Yeah, so like kind of like what he was saying, I spend most of the time at the office on my own, and that's great. You know, it teaches you how to handle problems on your own and expand your abilities. And then the times that Dr. Molesky's here with me, that's when I try and schedule the stuff that's more challenging, stuff that I wouldn't really want to venture out on my own with, like especially impacted wisdom teeth. That's what I'm trying to learn to be able to do on my own right now. So I'll try and schedule that kind of stuff where he's here, so that I'm trying to implement the techniques he's taught me to start doing those by myself. And then if I run into an issue, I can bring him in. He says, okay, this is what we would do in this situation. And then I can learn from him while he's here. So it's like the best of both worlds.
Mm-hmm.
Now, Dr. Nielsen, you say that, but I've seen you knocking out some wisdom teeth on your own too. So
maybe.
That's awesome. So on average, how many patients are you seeing in one day? And I know this will differ for both of you, but Dr. Nielsen, as an associate, I think you can relate to probably dental students the most. How many patients are you seeing in one day on average right now?
On a real busy day, it can get up to into the 20s. But I mean, if you're counting, it depends on if you're counting every single patient that I see. You know, obviously, some of those patients that I see, it's just for a new patient visit or a periodic exam or a denture adjustment, and those kinds of appointments, you know, they're really fast, 10, 15 minutes or less.
Mm-hmm.
But yeah, I mean, it can be up into the 20s if it gets really busy. But usually I'm doing like 6 to 8 like actual procedures in the midst of all those other, you know, quicker patient visits.
Mm-hmm. And what about you, Dr. Molesky? What is your, I guess, average patients that you're seeing a day?
I mean, it depends on a lot of things, whether I'm with another doctor or not. But what I'll say is, when you're working as a team, the number of patients is really a lot less of a factor than you might think, because you imagine in dental school, you're everybody. And you're trying to grab that tub of instruments and set up your room. 2 patients can seem like a very full day, where with technology and your team, you know, your timing, you're in a crown prep can be actually pretty short because a lot of the other things are being set up for you in advance. So it's like Dr. Nielsen says, you're encountering a lot of people, but you're not the only person. You're a part of a much bigger team.
Mm-hmm. So again, kind of sticking with this topic with patients, how do you go about scheduling in your office? Like you mentioned before, I think students worry a lot about time, knowing that they're not nearly as quick right now as they're going to be once they get more experience. So Dr. Nielsen, as far as the time you have for each patient, is that something that you get to decide, or do you make your own schedule? Do you want to talk about that a little bit?
Yeah, like I said earlier, you know, everybody's really, in my experience, everybody's been very understanding of the fact that I'm not as fast as a really experienced dentist. And so when they schedule your patients, they're really, the business staff are really cool about talking to you and saying, okay, is this enough time for this procedure? If not, how much time do you need? And kind of balancing it out to make sure that you're not, you know, spread too thin, because obviously if you got not enough time and too many patients, then everybody's unhappy because you're running behind. So that's something that you communicate real early when you start at Aspen is you let them know, okay, this is what I need for this procedure and this procedure. And so they're able to work with you for sure.
Mm-hmm. And Dr. Molesky, is there anything that you have to add on with your practices, how you guys go about scheduling? And yeah, I guess for associates, lead doctors, who's really running the schedule?
Well, the first way that you encounter Aspen is what's called onboarding. And so that's a 4-week process where you're not held accountable to any procedure. And your learning style will really dictate what you do during those 4 weeks. I have doctors that are very, analytical. They want to see it They want to read about it, they want to learn about it, and then they want to do it. And I have doctors that want to just jump in and do it. So during that 4 weeks, what you come to hopefully understand is that the biggest benefit that you have to give to your office is your clinical ability, is your ability to go in and predictably do a great procedure. And so however long it takes you in the beginning is kind of irrelevant, because you're working towards the goal of, you know, really being that great asset, that part of the team. So like Dr. Nielsen says, no one's getting upset about how long things are taking, because we understand this is all a growth process.
Mm-hmm. I think the big thing to add on to that is what seems to be really important with you doctors and dental students is the clinical autonomy. I did have a few questions about that, and I think you would say you guys have complete clinical autonomy within your practice. Dr. Nielsen and Dr. Molesky?
Definitely.
Yes, okay, awesome. And Dr. Molesky, you talked about the 4 weeks and the mentorship program, and you are Dr. Nielsen's mentor right now. So do you both want to talk about kind of that process and elaborate on that a little bit more? I think Dr. Nielsen, will start with you. Do you want to talk about how your onboarding and mentorship has gone so far?
Yeah, it's a great experience. Like he said, you know, it kind of depends on how quickly you want to jump in. If you want to ease in, their understanding of that, and your mentor's understanding of that. You know, for me, it was like the first week or two, I toured the office, got to know the office, got to know all the different staff and everybody I was going to be working with. And then I kind of got to know how the lab works, and actually did a little bit of the lab work myself to kind of see how the processes differ from what I learned in dental school. And then I spent a couple days assisting. So you really kind of get to know the in and out of everything before you actually start jumping in and doing procedures. I think I started peppering in a little bit of procedures third or fourth week. So.
Mm-hmm. And Dr. Molesky, so you have gone through that process a while back, and now you are a mentor. So you can provide, I think, some great perspective on that as well, if you want to add anything.
Yeah, I mean, you know, you talk about clinical autonomy. One part of our onboarding is we spend a lot of time talking about what is general dentistry, because the patients you're encountering are going to have needs greater than maybe a single filling or an individual crown. And so we think we really have in-depth discussions about, you know, when do we decide to go to a denture? When do we decide whether a tooth is restorable? What are the factors that go into it? So every lunch we spend time together talking about that. The clinical autonomy is very important. By the end of the onboarding, what we want is for the doctor to be able to honestly to fall down a little bit so that they can get back up. You know, you're going to learn a lot more from your mistakes and challenges than when everything goes right. But having mentors who can jump in and really help you navigate it when things don't go as planned gives you the confidence to take on what it needs to grow.
Mm-hmm. Awesome. I'm glad we touched on that with this call being with a lot of students on this. I think mentorship is what's really, really important to them. So Aspen does have a really strong mentorship program. Everyone is assigned a mentor doctor, as Dr. Nielsen has Dr. Molesky. So it's a very guided process, as they said. They don't just kind of throw you to the sharks and teach you to swim that way. So it's very individualized, and nobody wants you to fail. So they're going to make sure that that doesn't happen. So moving on here, we had some questions about ownership, and I know Dr. Molesky brought that up a little bit, and he is one of our owners, so I think I'm going to have you talk about this. But one of the questions we had here was, you mentioned that the offices are owned by the doctors. Can you elaborate on that? What percentage do the doctors own? I guess we'll start there. Dr. Molesky, do you want to take that?
Well, sure. You know, the doctor owns 100% of the office.
Mm-hmm.
And so the relationship is very much a doctor clinically driven approach. The dental service organization cannot really dictate or determine how we're going to run clinically, but a doctor can. So when you have a local doctor owning the office, I can really interact with the doctors, and we can really work together a lot better than, say, a management company that didn't have a doctor, a strong doctor doing that. Because they can give advice, they can give recommendations, but when you know, and Dr. Nielsen was here with me, I think it happened, you know, you're halfway getting a tooth out and the blood's gushing like a faucet, you know, you don't want the manager saying, what do we do? You know, you want the doctor saying, I got this. Let me show you how it's done, you know?
Definitely. And like you said, so our offices are 100% owned by the doctors. I like to kind of reiterate that because I think most of the time with DSOs, students think it's like 49% ownership or, you know, just stock options. I'm sure that's what you guys hear quite a bit. But with Aspen Dental, you guys completely own the practice and have a business partnership with Aspen Dental Management, the company that I actually work for. So on the topic of ownership, how long does it take to become an owner? And I guess, like, how do you become an owner? So Dr. Molesky, do you want to talk about that process that you went through, going from being, if you were an associate lead doctor, and then becoming an owner and buying into the practice?
Well, the ownership is really just individually dependent. We have owners that less than 1 year out of school can own an office. In fact, one of my partners did exactly that. When you come from school into your first career, you want to focus on yourself clinically. That's the associate role. And as you get your clinical skills and the timing to where that's really not the challenge to you, then you can look to take on bigger things as far as the, you know, the leadership, the operation of the office. That's called our managing clinical director. The managing clinical director in itself is a very rewarding career. It's a very well compensated career. It's something that, you know, you can support your family, you can have a good lifestyle on. But the doctors that are managing clinical directors and really love the office location they're at, they really want to invest in their office. And by being an owner in their individual office, they see that just growth of the career to the point where they bring on other doctors with them, and they grow their careers as well, and they start looking into the future. So certainly it can be done in a year, but it's okay if it's not done in a year. It's just all about your particular needs.
Yeah, definitely. I mean, it's going to depend on you, your confidence level, your skill level, the location that you're at. There's a lot of places that have more opportunity than others. We do have partnerships as well. I don't know if you have any. Do you have any partnerships, Dr. Molesky?
I do. I have two partners with me now.
Awesome. Yeah. So like you said, even if somebody does already own the practice, let's say you've been a managing clinical director, and you work great with the owner of the practice, there is the opportunity to buy in as well as that level. But I mean, just the process of becoming an owner, you can come to Aspen Dental directly as an associate, directly as a lead doctor or MCD, but you do have to be with Aspen before becoming an owner. But again, there's no set time limit to that. So it can happen in under a year, it can happen in 5 or 6 years. And there's no set limit for how many offices you can own either. I think Dr. Molesky owns 7.
Yes.
Is that right? Yeah. So I mean, I think the most somebody owns within our network is somewhere in the 20s, which is quite a few. That's definitely not the average, but I mean, you can just own one office or you can own multiple. So it's again, going to depend on you and what you're looking for. But no matter what it is, the opportunity is there for you. We did have a follow-up question that is a little bit off topic. I think it was from earlier. It was, we were talking about new patient exams. So somebody wants to know what our new patient exam is like and how you manage that between scheduled patients. I think Dr. Molesky, sorry to have you talking so much right now, but do you want to talk about the new patient exam?
Yeah, well, I think Dr. Nielsen, you saw some great new patients today. You could just kind of run through how that operation, how it works for you.
Yeah, so you know, whenever I'm in the middle of a procedure, the assistants will be bringing other patients back, so they'll come get me. And if I'm in the middle of something, we have little whiteboards, and they'll write down, and they might whisper to me, "Hey, you know, I have a new patient in Op 1 or whatever." And then what I'll do is anytime if I'm in the middle of a procedure, I'll just look for a point that I can get away for a minute or two. You know, whether it's having the assistant put a Toffelmeyer on a tooth in the middle of a filling or something like that. Anytime I have to break away, I kind of gauge based on how quick the other appointments that I need to take. And then for a new patient exam, I'm basically, first thing I'm asking them if they have any teeth that are giving them problems or any specific reason that they came in that day. And then I'm doing a comprehensive exam, looking at every tooth. And then I'm also doing a quick little oral cancer screening. And then once I've looked at every tooth, I'm looking at the x-rays to see if there's anything else. But, you know, it's not always just looking at every single tooth and looking for all the cavities. I think one really important thing that I've learned from Dr. Molesky is more of like a broad, long-term view of treatment planning. So anytime I'm going in there, I might start looking at tooth by tooth, cavity by cavity, but then I might start to realize, okay, this is not simply putting a Band-Aid on every tooth. So anytime that I'm looking and seeing a lot of edentulous areas, you know, that changes the treatment plan. So as I'm going, I'm actively thinking, okay, what's the end goal here? What am I doing to get this patient to long-term health, long-term stability? And I'm kind of drawing my treatment plan as I go in that way, and then present the treatment plan to the patient in a clear, concise way, simple way. Like we said, Aspen's all about making dentistry easier for the patient. So I'm kind of making it simple and easy for the patient, and then asking if they have any questions about anything I said to them, making sure they understood why I prescribed the treatment plan I did, and then explain that the office manager will talk to them about the costs and the financing options.
Awesome. So as an associate, you were just talking about treatment planning. Can you elaborate a little bit more on the relationship you have with the lead doctor or the owner of the practice when it comes to the treatment planning? Is that something you guys do together, or just being a few months in, do you have complete autonomy over that?
Definitely complete autonomy. If I do interact with Dr. Molesky with treatment planning, it's if I run into something where it's a little bit complicated and I say, you know, maybe I don't know exactly what would be the best thing to do here. And so I might text him, or if he's here, I'll say, what do you think about this, this case? And he'll help me in that way. But most of the time I'm making treatment planning decisions by myself for sure.
Awesome. Do you have anything to add on to that, Dr. Molesky?
You know, Dr. Nielsen just put it really great. You know, as a general dentist, you got to take a step back. And when you start putting Band-Aids on every single tooth, the profession becomes a little bit frustrating. But the prosthodontic portion of it can be very rewarding. You have an in-house denture lab. You get to work with your lab tech one-on-one. You can really troubleshoot removable pros a lot easier. And now with dental implants, patients really have a satisfactory result with implant-supported prosthetics. And so you get to really see people go from, you know, hopelessness and disease to really great looking and functioning results. And it's just about seeing the bigger picture like that.
Awesome. So we did have another fun question just come in that was, do you have any say in what equipment and supplies you use in your office? Or I guess they want to know if Aspen Dental Management has control over that, or if you as the doctors get a say in what equipment you're using. So Dr. Nielsen, do you want to take that one?
Yeah, you definitely have a say. You know, as I've started here at my new office here in Kennewick, Dr. Molesky has been ordering a lot of new equipment to kind of get the office up to state of the art, you know. But in addition to that, just on a daily basis, if I see a burr that I haven't seen in the, or I'm missing a burr from the burr block that I'm used to using, or I can order that. I'll ask my lead dental assistant to order that. And the other day I was wanting to do a little bit of border molding and we didn't have the compound wax. I was able to order that kind of stuff. It's pretty easy. It takes about a week to get it in, but most of the things that you can think of if you need it to help you get the things done that you need to, it's pretty easy to do it.
Mm-hmm. Dr. Molesky, anything from you on equipment and supplies within the practice?
The cone beam CT is really a great asset for your molar endo, for your implant placement, and for your impacted thirds, especially when you're learning. When you can see how the lingual nerve runs either lingual or facial to the tooth and is in relation to how you're going to trough around it, you gain a confidence that is not so worrisome. The cone beam is really important. The iTero scanner for 3D scanning your crown preps, for scanning your Invisalign, for scanning for your cast partial dentures. Technology is a big part of it. The endo supplies like Wave 1 and our Gutta Core carrier-based obturation. And I'd like to ask Dr. Nielsen to kind of talk about that because, I got to see how he really adapted to those systems, and he could talk about his experience with it.
Mm-hmm.
I'll say that my experience in dental school, I'm sure it's the same that a lot of people have in dental school, is I felt like everything was slow as molasses. Everything was hard. I felt like most things were harder than they needed to be. And you kind of, as you spent more time in dental school, you kind of realize just how tough it can be. Even though that there are better and faster alternatives and simpler alternatives, you kind of have to learn it the right way first. I guess that was my experience in dental school. And so I knew that there was going to be a lot of things that were going to help me get dentistry done faster and more efficiently. And it's been great. Using the Gutta Core system is great. When I did root canals in school, you had to do the master point, gutta percha point, and then you had to put 1,000 accessory points and sealer, and it took 1,000 years to obturate. But with the Gutta Core system, in conjunction with the Wave 1 system, it's all streamlined and more efficient and quicker and easier, and it makes the whole process much more fun and less intimidating for me.
Mm-hmm. And so while we're on the topic of supplies and equipment, I just want to throw in there that is one of the big benefits of working for an organization like Aspen Dental. So when you have multiple offices within a network, you can get them in bulk. So we have partnerships with companies like Align. When we talk about the iTero scanners, I think we are Align's largest purchaser ever for iTero scanners. So of course our offices get those at a cheaper cost than maybe a private practice. And same with, we have partnerships with Henry Schein, Nobel. Those are big ones that come to mind. So that's a huge benefit to you guys within your practice as well. So moving on here, we did talk about compensation a little bit earlier, and I said I would get to that later. So somebody wants to know what our compensation model is. Dr. Nielsen, I know you brought that up in your intros as one of the reasons why you thought Aspen Dental might be the place for you. So do you want to go over that for everybody?
Yeah, I think one of the biggest things that drew me to Aspen was the stability of, a pretty fixed salary. I was worried about, having to worry about production. I'd heard of people going to private offices where they might have a daily guarantee at the beginning, but then there was a certain fixed time frame where it would switch over to production. And that worried me because it's like, well, what if I'm not fast enough by the time that we switch over to production? What if I'm suddenly not making enough to get by? And Aspen's great because you get that daily guarantee every day. They schedule for you and make sure that your schedule's busy. And in return, you just have a set daily guarantee that you get. And so that provides that stability. So I'm not afraid about how fast I'm going. Obviously, I'm trying to improve my speed every day. But it's great to have that. And then on top of that, you have the incentive of profit sharing. So every month You, as an associate, you can make up to 10% of the profits earned by the office. And that's a great incentive to get faster and to improve your production. But it's great to know that you're not going to be out of luck if you're not fast right off the bat.
Mm-hmm. Anything to add, Dr. Molesky?
You know, Dr. Nielsen put it really great. When I came out of school, it was very popular to have you're paid on a draw, which meant you could own or you could owe a debt to your job. And how crazy is that? Well, Aspen never did that. They never would do that. So you come to work, you're going to get paid. That's no question. But you know, the advancement is there. You know, you can have a career where you can do $300,000 a year as a managing clinical director. You know, many managing clinical directors are doing that. So you can look at it and say, you know, maybe my lifestyle is I would like to have, you know, more ability to be with my children, to be more involved in the education, to have more ability into the life. Well, having a career that's compensating you properly allows you to have that freedom.
Mm-hmm. And a follow-up question to that is, this is like my favorite question because I do think it is a huge misconception within the industry, but someone wants to know if we have quotas that we have to meet or that you guys have to meet. So are there quotas in your practice, Dr. Nielsen?
There are not quotas. There's metrics that you follow to try and set goals for your office to improve and everything, but not quotas.
Mm-hmm.
Dr. Molesky?
There's no quotas. There's a lot of patients. There's a lot of people who need help, and there's a lot of great procedures to learn. And I'll tell you that a lot of the most fun procedures are the things that make your day easy. You know, when you do an implant overdenture for somebody, it really is a lot of what you needed to do for that day to have a successful day at that office, and it was a fun procedure. So it's all connected.
Mm-hmm. Yeah, so it's definitely no quotas. I mean, obviously you have goals within your practice. You do want to run a profitable practice, but you know, there's nobody, especially from the management side, telling you, you need to do this much of this much of this. And like Dr. Molesky said, there are a lot of cases within, you know, other DSOs or other organizations where if you're not producing a certain amount, they do take money away from you. So again, I just want to say that's not something Aspen does. You make that daily guarantee for showing up to work that day, whether you see one patient, whether you see 100 patients, you are going to make that for the lifetime that you're with Aspen, and it's never going to be taken away. And then you do have the opportunity to bonus on top of that. And that's based off of the entire office collectively. So that includes, you know, your lead doctor, your associate, specialty that comes into the office, hygiene, all of that together collectively is how you guys are going to bonus. So that really enhances the, you know, the team aspect within the practice. And there is a full benefits package with that as well. So that's PTO, 401k, vision, medical, all of that. Dr. Nielsen, we had a question specifically for you come in. That was, you are a recent graduate. Has working for Aspen Dental met the expectations that you had before taking on your role?
Absolutely. I have nothing but good things to say about Aspen so far. It's exceeded my expectations, honestly. I mean, I knew a lot of good things about Aspen going in, but I've just continued to learn more and more great things. It's been a great place to learn thus far, and just awesome. Nothing but good things to say.
Awesome. Again, we had another live question come in asking, do your dentists sign contracts? And if so, what is the minimum amount of time? Do you want to take that one, Dr. Molesky?
Well, I would say the timing comes to incentive programs. We have offices that are offering student loan repayment. Mm-hmm. And for those, you're going to be, you know, in order to receive the student loan payment, you're going to be in that office for a time period. So there are some things like that. But as far as not being able to leave, that doesn't exist. There's no covenants not to compete. There's no, it's really nothing. I mean, it's all about your happiness. You know, we want you to be happy. And if you're happy, it's great. If it's not, we do everything we can to help you to do it. But if it's just not going to work out, that's okay too.
Mm-hmm. And I'll add on to that by saying, and this might be something you had as well, Dr. Nielsen, but I know we a lot of times don't even like to use the word contract because we call them letters of agreement. I feel like typically contracts are a million pages long, especially in your profession. Sometimes you might even have lawyers look those over, anything like that. But ours are 2 pages. They're very, very simple. They pretty much just state your compensation, maybe your location and any other possible bonuses you might have, like relocation or like student loan he mentioned. And student loan is definitely the one time that there's probably a time restraint on there, but most of the time there's no radius clause, no restrictive covenants, anything like that. Do you have anything to add, Dr. Nielsen?
Yeah, that was another thing that drew me to Aspen. One of the many things, you know, at the other places that I receive contracts from, you know, it feels it's like intimidating because if you sign it, then there's all these things that you're binding yourself to that keep you locked there, you know. And Aspen made me feel a lot more comfortable because I wasn't worried that they were trying to lock me down. The fact that they have a no compete clause and that they don't have all the stipulations makes you feel like they know that they're going to provide you with a good job. They know that they don't have to worry about you running because they're providing you with a good atmosphere and a great place to work. And it made me feel less worried about it.
Mm-hmm. And I think a big part of that too is like we want you to want to be at a place that you want to work. You know, I feel like it comes down to patient care, and if you're unhappy, you're not going to be providing your best care to patients. So nobody wants you to feel stuck at a place that you're not happy. I think if you want to leave, all that we ask for is a 90-day notice, and technically you could work across the street if you wanted to. You just can't take any of your patients with you, which I think that's a pretty standard thing within the industry. Another live question came in, which was, is there the ability to offer care for a family for free? Do you want to take that, Dr. Molesky?
Yeah, I mean, it's an organization, but it feels like a family, you know. And one of my doctors, her daughter had a toothache, needed to take out a tooth. What are we going to do? Say, hey, doctor, can you bring your wallet? Come on. You know, her husband broke a tooth. I did the root canal because she thought, you know, she probably didn't want to hear about it. You know what I mean? She's like, Dr. Molesky, you do the root canal, then he'll come talk to you about it. So it's all very, it's informal. You know, it's very easy.
Mm-hmm. Do you have anything, Dr. Nielsen?
Yeah, everything he said. I echo what he said.
Awesome.
Now he's got some family member in mind that needs a lot of work.
Right.
And he's like, all right, I'm going to call it up now.
Yeah, exactly. And I mean, while we're on the topic of providing, I guess, free care, I do want to say we do have a lot of charitable type organizations within our network. We have our annual day of service. We provide free care to veterans. We have a mouthmobile that drives around the entire US that has, I think, 3 or 4 offertories in it that provides free care to veterans. We do mission trips. And I mean, you can do procedures pro bono as you see fit. There's nobody that's going to tell you no. I think a big part of why people go into this profession is because they want to help people. So if there's a case where, you know, somebody really needs help and they can't afford it, you have the ability to say yes and help them. So if there's anything you guys have to add on that as well, I don't know if you've seen any cases that stuck out to you in that regard that you wanted to talk about.
I mean, the day of service and the mouthmobile are really rewarding. It's for veterans and, you know, people from all wars, you know, Vietnam, Gulf War, Iraqi War, you know, they're all coming and sharing their stories, and the VA care for dentistry is almost non-existent. So people who have been injured, have served their country, could come to you with a mouthful of toothaches, and you get to be the person to say, today it stops, today we help. And the mouthmobile is really cool. It has 3 operatories and basically a modified motorhome, and it tours the country, and it'll park it in some place that, you know, people can get to easy, and you go out there and and you do a great day of dentistry, and it's all free for the patient. Usually the news comes out, the families are there. We're always bring out food, and it's just a lot of fun.
Mm-hmm. Yeah, that's definitely some of my favorite stuff to take part in. Obviously from like a management side, nothing clinical, but it's definitely one of those that's just kind of an emotional but like rewarding experience. So I know it's getting closer to the end of this, and we did have a few COVID questions that I wanted to go over, so I saved those for the end. But one more question on a different topic. Do you offer CE? If so, how much, what kinds, and who pays for it? Dr. Nielsen, do you want to start us off talking a little bit about the CE we have?
I haven't delved into it a lot yet, but I get lots of emails in my Aspen email about CE. And one thing that I think is great is at Aspen, they kind of fast track you into being able to place implants, which is a great skill that I had very little exposure to during school. And so right off the bat, I'm taking these online CE courses to help me start getting in there and placing my own by the end of a year. So that's pretty amazing. And like I said, with all these emails, there's lots of opportunity for CE at Aspen, for sure.
Yes, definitely a lot of opportunity for that. Anything from you, Dr. Molesky?
Well, there's a couple big ones that Aspen offers. The first is called lift training, which is for Invisalign. That really takes you from never doing any adult ortho to really being comfortable. Behind that CE is an orthodontist who has direct contact with you on all your cases. So you don't have to be scared about delving in or diagnosing something incorrectly. And then the implant program is 3 tiers. It starts with the online didactic portion, which is followed by an in-person hands-on, and then into the live patient. And that's all no charge to the doctor. So the mentor doctors, when you do your implant training, they're going to be in that office with you. Sometimes they might literally hold your hand, say this angle or that angle. It's really a dedicated training.
Okay, I think based on the time here, we're going to go into the COVID questions now. Obviously, that's a huge topic that is on everybody's mind these days. It's basically everywhere. So during this pandemic, have you had any shortage of PPE within your office? Dr. Nielsen?
No.
No. Dr. Molesky?
No, we really didn't, because back into March when this all went down, the Dental Service Organization became an emergency task force, and they were sourcing out all of the PPE and all of the supplies from really difficult sources to find. So we got a good stock in the beginning, and we've maintained a very good stock. Everything you need, the face shields, the gowns, the caps, the N95 masks, just all of it.
Yeah, speaking with a lot of doctors within this time, I think so many of them have said they really realized the value of working for a DSO more so than ever during this pandemic, when it's so unpredictable and nobody really knew what to do. You have a whole network of people behind you that are giving you kind of the best advice and telling you what to do. And I know everything varied based on the state. There were a lot of different governors, different orders, everything like that. But did either of you have to shut down your office? Dr. Molesky, you want to take it?
Well, I was the one that stayed open. So when the governor of Washington determined that dentistry was not important, I knew that he was wrong on that. Dentistry is very important. And when offices started shutting down, our patients were crossing state lines begging for people to give them care. And I was able to keep 5 offices open, and I was able to keep 5 dentists working and staff working. In a time of panic, sometimes that dedication to your profession really makes a difference. And we were able to help patients that definitely would not have been able to get that care.
Dr. Nielsen, were you able to stay open or?
I've only been here 2 months. When I came here, everything was already kind of blown over.
Yeah, so you jumped in just right at the perfect time, didn't you?
Yeah.
So what types of protocols and policies have now been put into place to help protect the staff and patients from COVID within your offices? Dr. Lowsky?
Well, the CDC, the governor, they give some guidelines. We have the social distancing. We have the PPE. We have the screening. No office is offering testing yet that I know of, but that's something we could transition to if that became a part of it. So, you know, we've not had an issue of outbreaks in these offices. You know, we're encountering hundreds of people every day, and out of all my 7 offices, there's not been an outbreak, not one. So we've been doing the right thing. We've been very fortunate.
What about you in your practice, Dr. Nielsen?
Just using a little bit of additional PPE, you know, you have little stay 6 feet apart, social distancing stickers on the floor. And like Dr. Molesky said, you know, we've added to the questionnaire for new patients, you know, if they've been experiencing any of the symptoms. But yeah, mostly it's business as usual.
Yeah, I know I visited a practice for an appointment actually not too long ago, and they had us, again, taking temperatures when you walked in. I'd wait in the car until they called and it was time for my appointment, things like that. So they're definitely taking the proper precautions within the practices to make sure that everybody's as safe as you can be right now. It is about 7 o'clock, so I do want to end on one more question for each of you. So Dr. Nielsen, I think this would be a great one for you to answer as you're a recent graduate. What advice do you have for students graduating this year who are going to be looking for jobs soon?
Come work for Aspen.
I told him to say that.
Yeah, no, nobody paid me to say that. It's been a great experience. You know, I think it's a wonderful place to work. You know, obviously there's pros and cons to working anywhere, but for someone straight out of school, I think it's a really awesome place where you can learn, you can improve, and you can feel at home, and you can feel like people understand that you're new out of school, and they teach you to get faster, and they teach you to improve your skills, and you can add new abilities to your skill set within a short amount of time. And, you know, I mean, I could go on and on. The benefits are great. Like I said, the compensation's great. The profit sharing ability is great. The mentorship is huge. That's been the biggest thing for me. So I would say it's a great place to come work, you know. So come work for Aspen.
Thank you for that. And I mean, I think a big thing to add on to that too is like, just ask a lot of questions. Like you are getting to the point in dental school where you are going to be hearing from a lot of different people, looking at a lot of different options. You know, there's public health, there's Dsos, private practice, I mean, military, so many different options. And the only way you find out what's best for you is to ask those questions. So I think a great start is joining something like this webinar. But Dr. Molesky, the question I have for you is one of the questions I get the most within my role, and I think you would be a great person to answer. And that is so you are a practice owner that conducts a lot of interviews. When you are interviewing candidates to come work in your practice, what are some big things that you look for from a candidate?
I mean, what I look for is someone that loves the profession. You know, this is the best time to be in dentistry. The technology we have, the predictability we have, the patients we're seeing. You know, I want someone who wants to really enjoy helping people, you know, of being the best that they can be. You know, it's the work can be hard sometimes, but it's enjoyable because, you know, you're always working towards something. Dr. Nielsen is like an ideal candidate. You know, he came in, he loves the profession. He's killing it his very first month. He's taking on procedures that he's never done before. You just got to love it, you know. It's if you're not enjoying the position you're in, trust me, leave it, because dentistry is great. You should love every day of it.
Mm-hmm. Well, thank you both for those answers. And I mean, thank you for joining us for this whole entire webinar tonight. I know I enjoyed it. I hope that everybody watching did as well. Unfortunately, it is the end of the hour, and I'm sure these dental students do have a lot to do, probably a lot of studying to do right now. But if anyone has any last minute questions and you want to throw those in the Q&A right now, we'd be happy to take those. But other than that, I'm sure both of these doctors would be happy to talk with you one-on-one if you have more questions. I will definitely be following up with everybody after this, so you'll have my information if you have any more questions, want to talk one-on-one about, again, any more questions with Aspen or about job opportunities, especially for you fourth years. But I mean, we really, really enjoyed having you guys. And I do know, I don't know if you doctors know this, but we offered a $10 gift card for people joining us tonight. And I know that's probably on everybody's mind, so don't worry, you will get those. I will be sending those out tomorrow. But again, if you don't have any last minute questions, thank you so much for joining us. I hope you guys enjoyed it. And again, I will be following up with everybody tomorrow. So if you want to get in touch with either of these doctors or myself, I can set that up for you. But thank you, panelists. Thank you, everybody else. I hope you guys enjoy the rest of your night.
All right, good night. Thank you.
Bye.